Hello, my name is Aurae Beidler, and I'm here to present this webinar on integrating the OIG work plan into your compliance program for 2022. I'm an independent contractor, and I've worked in the healthcare industry since 2002 for health systems, outpatient clinics, including behavioral and dental health, with an emphasis on compliance operations and program implementation, training, auditing, and privacy of health records. I have a focus on, coding and billing issues, risk assessments, regulatory interpretation, internal investigations, and I've overseen the implementation of privacy and security programs as well as compliance programs in several entities. So today, our learning objectives are understanding the importance of the OIG work plan, understanding how that work plan can be incorporated into your overall auditing and monitoring functions of your organization, and then review some of the current issues and hot topics for 2022 and beyond. So let's get started. So the Office of Inspector General, the OIG for Health and Human Services, is an independent agency that exists in all U.S. cabinets. Specifically, as I said, we're talking about the OIG for Department of Health and Human Services. So you'll see it as OIG/HHS, which this entity strives to protect the integrity of the department's programs. And HHS's OIG is the largest IG with over 1,600 employees. So the OIG's activities for HHS include investigating fraud, waste, and abuse within federal healthcare programs, education and resources, reports and studies, manage the recovery audit contractors, discipline employees and organizations through exclusions, one of the penalties that can be provided depending on, intentional fraud, waste, and abuse down to, violations of anti-kickback or STARK. And then also negotiate corporate integrity agreements, so CIAs. You may know of companies that have been through these, set timeframes to work through, auditing with the OIG and beyond. So hopefully giving you this overview of the OIG will help you see how this, the work plan that the OIG puts out can be useful in your auditing and monitoring functions. And I just answered, why should my organization care? So auditing and monitoring is a key element of an effective compliance program, which can definitely help in many operational, the operational success of your organization. For most entities, effective compliance programs are voluntary. In some agencies, they are mandatory. But, for the most part, this is a way to show your due diligence, how you're working through many of the things that can make, your organization more effective. The 7 elements, and these are the minimum that the U.S. sentencing guidelines requires for an organization to have an effective compliance program, are, having written standards of conduct, written policies and procedures. So getting back to auditing and monitoring, if you don't have those written procedures, written policies, written statements about what your organization does and how your employees should act and behave, you're not going to have a good framework or understanding of your processes and your controls in place, and it would be difficult to be auditing and monitoring if there are no standards. So having a code of conduct, having policies in a written form, and accessible to your employees as well. Designation of a chief compliance officer or someone who's your compliance officer for your organization, who reports to the board of directors or the CEO, and a compliance committee depending on the size of your organization. compliance education and training. That's why we're here today. So, having education and training for your employees, having educational resources available for questions, doing an annual training, doing ongoing training. If there's a regulatory change, making sure that your employees know. You're going to have subject matter experts in different areas, so they should also be telling you of changes as the compliance officer. Our fourth element is anonymous compliance hotline and having an open door policy. So do employees feel empowered, and do they trust that they can come to you as a compliance officer or to just their supervisor and be able to bring something up, a question, a concern? Or do you have an anonymous compliance hotline, either an email inbox or a phone line where the public can bring questions and inquiries as well? Number 5, system of response and enforcement disciplinary action kind of jumps into number 6 as well. So if you have something happen or someone brings a question, is there a set process for investigation and response to any allegation and a follow-up? And then auditing and monitoring, what we're talking about today. So of your set systems and controls, are you looking at what you're doing? Do you have external auditors coming to look at your practices, looking at your financials or looking at the work plan you've put in place? Do you have a compliance committee or a set of leaders who are monitoring their daily operations to ensure that you don't have any issues? And if you have something, leading into number 7, are you stopping the bleeding? Are you stopping it once you know, correcting things, making those changes, implementing those changes, and then following up and re-auditing to ensure that you have corrected the practice? So just a reminder that the OIG also has guidance on compliance programs and states that every effective compliance program must include all of the applicable elements listed here through a good faith and meaningful commitment on the part of hospital administration, which includes the governing board, the CEO, anyone who's involved, and the board should definitely be involved with your compliance program. Okay, so now we'll get into auditing and monitoring and kind of the purpose of it, how you're going to build it into the OIG work plan items that you've identified for your organization. Auditing and monitoring functions can assist in identifying risks to your business. If you're not looking at your practices, maybe you don't have issues or you don't know you do. So until you actually audit and monitor your organization and its controls and practices, you don't know. It can also help you identify if controls put in place to remediate a risk are working and all risks are mitigated. So if you're working at privacy, security, compliance, billing, whatever you're looking at, if you've had an issue in the past and you've had to mitigate that risk, it can help you identify if what you've done is actually working. Auditing and monitoring can assist with preventing a real or potential risk from escalating. It's really that early detection. You can also do, real-time audits or prior to billing. So you could do something in more of a preemptive way. And then also the more typical retrospective audits or reviews of things that have already been paid and reimbursed back to you. But, there are ways to do more proactive auditing too. Really can show that early detection. Maybe if you have a new service line or something that you're doing that's new, you might want to do some quick audits before things go out, maybe 100%, maybe you have a new provider. So you're going to do 100% audit for a specific time just to ensure that there are no potential risks. You don't want to get down the road 6 months later and go, wow, you're at 50% accuracy on your coding and billing. So you definitely want to make sure you have those in place prior. Auditing and monitoring, as we just heard from the OIG, also provides good faith. It shows that you are doing, you have an open book. You're looking at things. You're doing your best, your due diligence to ensure that things are compliant. and that you're living up to the mission, vision, and values of your organization. And it ultimately changes and guides behavior. So especially if you're doing things early on as an early detection, you're able to change those behaviors and have just better success down the road, especially with maybe a new provider or a change in your service line. So you're able to make sure that you have things, solid moving forward. So we're going to go through the how, who, what, when, where, and why of auditing and monitoring. So how do you conduct audits and monitoring? With this function, it can be, full on formal audits. You can have, an external auditor coming to do an audit. You can do monitoring. You can do internal monitoring. So like I said before, having supervisors, service line leaders, being those experts and looking at those day-to-day functions or those weekly functions to make sure, kind of a pulse check on, the services being coded and billed to ensure that they're being done appropriately, or documentation. If there's a documentation concern or just want to do a check into something, you can do a probe audit as well, or just take a look. You can also do a mock survey or a mock audit. So, if you're preparing for your annual survey or, your triennial review, you might want to do a full-on mock survey of what's going to happen going through, from the very beginning to the end of, working with providers and employees on what they'll incur, and have some really good training and educational opportunities from that. You also might want to do a risk assessment. How do you know what your top priority is? So you want to make sure you're assessing all of your risk, getting it into a functional, a chart or some kind of spreadsheet or database, and then being able to assign a value to each of the risks, and work through to figure out what your top priorities are for a set period of time. So for your annual work plan, you may think everything's a high risk, but as you go through it and work with your compliance committee, you determine what those top 5 priorities are that you must get done that year. And we'll see how the OIG work plan works into that too. And then the who, is this going to be an internal audit, an internal monitoring activity? Is it department level? Is it, service line level? Are you just working with, going around your organization and working with specific areas, inpatient, outpatient? Or is this an external body that you're going to work with in a more formal manner? The what. So we're talking today about, building your annual compliance audit work plan. And this is really through the lens of compliance. You may also have different types of work plans. You may be working with security on security awareness or quality assurance, or any of your other areas. So just looking at kind of an annual work plan for this. And then the when, are you going to be doing concurrent reviews, the early detection, or is this more retrospective, maybe going back a full year or beyond, or when you had a change to, a system, or you transitioned your electronic health record system, or had a new service line, or maybe you had a new leader in your organization. And then is this annual or ongoing? Maybe if you have your annual compliance work plan, you have things that you're doing all the time, like checking for exclusions on your employees, something you should do no matter what, that you're going to be ongoing and consistently reviewing, but you want to see those results all the time. And then where? So we do still have organizations that have paper, or is this your electronic medical record or one of many electronic systems? So kind of where are you going to pull the data from, and, what format is it going to be in when you're doing your review? And then the why. We'd already talked about some of the why, having a voluntary compliance program, but is this a proactive stance? Is this a reactive stance, as we're going to talk about with some of the OIG work plan or the audits that have occurred? Are you just looking for potential issues, or have you seen trends, maybe trends in your denials or trends in, from a certain payer or whatever you're looking at, or an industry standard too. So you're at a conference and you hear that everyone's looking at their pain audits. Okay, well, I'm hearing that that's something, a standard we should be looking at. So let's add that in and let's take a look at that. Let's audit that or monitor that. Okay, so with our annual compliance audit plan, where to begin? So we really want to determine the preliminary list of compliance risks to be assessed. Like I said before, we're going to go through this and then we're going to determine, are there risk indicators which should be a higher priority, and how do you prioritize them? So we're going to go through conduct a risk assessment. However that may be. Maybe you want to do interviews of employees or leaders. Maybe you just want to do it more internally through your compliance, program. Maybe you just want to use your last year's risk assessment and then reassess that. You're going to prioritize the risks identified either through some type of a numeric score or just kind of a high, medium, low. And then you want to identify resources that'll be needed to implement that audit plan. Some of these may take a lot of resources that we may not have. So maybe you're going to, put something off a year, but you want to document why, especially if it's a high risk that's been identified, kind of determine what those resources will be. You also want to have buy-in from leadership, from your board, from the service line leaders who will be working on these audit functions, and really identify with them as to the why we're doing this. You also want to have documentation of your risk assessment function and how you've prioritized things and kind of why you're maybe not looking at some of the lower risk areas that year, and how you're going to look at reassess the next year. Evaluation, and making sure that everything, especially with the buy-in, is ready to go, and then finalize that plan. So when you're prioritizing, you might be looking at some non-compliance behavior, either real or perceived. You may hear things during your risk assessment. So maybe it's something you want to review and look into. You might have new business, new systems, new people. You might want to look at vulnerabilities of areas that may not be well managed, or something you kind of know that's been an issue in the past. And then also that external focus in the market area, the industry standards as well. So some of those resources, and we will get back to some of these as we talk about the OIG work plan items as well. So these are the resources used to develop your compliance work plan. The OIG work plan, which in the past used to be an annual that would come out fiscal year in October. Now it's updated monthly. So it's really more useful. It's more up to date. So we'll look at that. Advisory opinions from the OIG. Is there something that they've weighed in on that you want to look at for your organization? Two of the key things we'll talk about later too are the audits that OIG actually does. So when we look at the compliance work, the OIG work plan, we're looking at things that we can look at in our organization, but just know, the OIG is out there doing audits as well, especially on, CMS or HRSA or FDA or, CDC, wherever your focus areas are. You want to look at those reports. If you have any local medical review policies or local coverage decisions, and we'll talk about our Medicare administrative contractors in the Oregon area, we have Noridian. You may be in a different state and have a different MAC, but you want to see if any of the items on your work plan have a local coverage determination or a national a policy as well, that you're looking at that when you're setting up your audit or your tool you're going to use. Are there any Medicare bulletins, CMS updates, or even from your contractor? Has there been any webinar, or have I guess ask the contractor items that have come out on those areas? Peer review organizations, or contractor audit descriptions. So if the RAC, the recovery audit contractor, or even the CERT, comprehensive error rate testing has had any findings in these areas, you want to make sure you're pulling those descriptions, those announcements. They're going to give you some of that detail for your audit. So like I just said, these are as of just last year, June 2021, for the Western states, except for California, Hawaii, Nevada. Well, I guess we're all Noridian, but different jurisdictions of Noridian. And then you'll see the others, Palmetto, WPS, all of the other areas as well. So make sure you're looking at what your contractor, the ones that have been given that power to work to provide you reimbursement and education on your Medicare claims, that you're looking at what they have and what they've provided. So one of the things that the OIG puts out for HHS is the top management and performance challenges facing HHS. And this really leads into the areas you'll see on the OIG work plan, and where you see, OIG and HHS will be focusing their attention. And we have a 2021 report as well, which it's the same top highlighted areas as it was in 2020. So safeguarding public health as we're still in the COVID pandemic really is, the core mission of HHS is to enhance the health and well-being of all Americans. So many resources focused on the pandemic that, to operate effective public health programs, HHS really will be focusing on those efforts with its stakeholders, such as the FDA. You'll see a lot coming from the FDA, a lot of work with HHS, CDC and beyond. And then I think key for a lot of the things we see on the OIG work plan is the integrity of the financial integrity of the programs. With 2.8 trillion in budgetary resources, that's a lot of money. Medicare being the largest health insurer, with more than 1 billion claims per year, and then Medicaid as well with 81 million beneficiaries. There's a lot of money flowing from, services and claims that, OIG will be focusing a lot of its efforts in ensuring that all of this is done in a compliant way with integrity, as we see, fraud increasing as well in our area in healthcare. Also delivering value, quality, improved outcomes, relating to value-based care, value-based payments, protecting the health and safety of beneficiaries. We have some, security and privacy components as well. So this is just key to see where those efforts, those top areas that affect the department will be in the coming year. So the OIG work plan, it goes back, it has an archive that goes back to 1997. And as I said before, a lot of the work that was done in the past was on an annual basis. So we all had to wait for it to come out before we were able to, plan our work for the year. The OIG work plan sets forth projects that the OIG plans to undertake during the fiscal year and beyond. The current work is now web-based. So in 2017, the OIG moved towards a web-based format. Instead of having a one report coming out, it's now updated all the time. And that will really increase transparency about the OIG's ongoing work. You'll see when they revise something, when they complete something. So it's something we want to do on a monthly basis now because it has newly initiated items and items removed and completed. So it's good to see. You'll see things being pushed out to 2023, and then maybe you'll have more time to actually review that within your organization if you want to look at it before the OIG starts their work. So we'll take a look at the report and I'll show you where it's at so you can see how that works. So if you go to, you can just Google it too, OIG, HHS, and then find the work plan under reports and publications, and then the active items. You can search for work plan items, or you can download the report and manipulate it yourself. So let me show you that. So I'm going to actually show you where to go and how to download that. So I found the report. I just Googled OIG work plan, and here we are. And you can see our active work plan items. You could go through, you can see as of January 2022, all the ones that have either been, these are all active. You can go through and look at recently added. And you can also download the work plan. So I'm going to do that, and then I will show you how I would manipulate that report. So I'm going to open up and share that with you today. And I'm sure you all can use Excel probably even better than I can. So I would actually go in and I would change this all to a table, and then you would be able to filter it down by, you probably want to look at Centers for Medicare and Medicaid Services, and maybe sort by, let's take a look at what CMS has on here. So we're actually going to change the agency, because remember, HHS is very large. If you work for, a federally qualified clinic or a rural clinic, you might want to look at what HRSA is doing. If you work with substance use disorder, you might want to also look at HRSA. But we're going to look real quickly at Medicare and Medicaid. And then you can see, we've narrowed this down. We can look at when something has been added, has it been revised? And then you can also Control F. You can look for some of those topics. So if I want to look at telehealth, I will be able to find telehealth in that way. I can go over to the description and look at what OIG is looking at. So I would say download the report, be able to manipulate it, take a look at it, and then add in your comments. So the next thing we'll talk about is how to use the OIG work plan. So once we've downloaded it, we're looking through it, we can then identify sections of interest to us, like I said. So if we're looking at Medicare, maybe we're just inpatient acute care, or we're going to look at Part A, maybe Part B as well. Maybe you want to look at your prescription drug or your managed Medicare, Advantage, or Medicaid. Maybe you only want to look at Medicaid, or like I said, FDA, or HRSA, public health, and maybe Indian Health Services as well. So you want to take a look at, narrow it down to those areas that you want to add to your work plan. And then I like to categorize them. So you might want to categorize something as an FYI only. Maybe it's OIG reviewing HHS, but it's something related to, financial, or something that you're not going to be auditing yourself. But you can use it for educational purposes. You could record a webinar. You could use it as training for your employees, and then maybe turn it into an audit in the future. So it's an FYI. It's something we might want to look at, but we're not going to be adding it to our work plan at this time. You might find something that you want to add to your monitoring, something where you aren't going to spend the resources to do a full formal audit, but it's something you want to delegate to a service line leader to add, to do some ongoing monitoring of those services. You might want to identify something for an audit. Maybe you want to do a quick probe audit. Maybe it's a service you don't know if you provide or not, or it's a new service, or it's something you just haven't reviewed in the past. So maybe you'll do a quick sample and probe audit to see, what does this look like? Maybe we only have 5 claims on this. So maybe we'll do a full review of those 5, or maybe we just won't include that in our work plan. Or is it something you're going to do a full audit on? and fully investigate as part of your compliance work plan. So I just did this with you. So you can create your own work plan using the OIG action work plan items download. So take that spreadsheet, manipulate it, use it however you'd like, and add it for your annual work plan, but then also know that, it will be updated monthly. So you want to make sure that you're adding that to your calendar to make sure you're looking at things if something's changed. Maybe something's taken off the OIG work plan altogether. So maybe there's a regulatory change and it's revised. So definitely make sure that you're, one, downloading it for your audit plan, your annual work plan, and then two, make a note to look at for updates every month. So now we're going to transition and look at some of the current issues and hot topics that I chose. I was looking at more of an outpatient setting, but you can definitely look at the work plan from the acute care side. And like I said, any of the service areas that you're interested in. So we're going to look at telehealth services, review of Medicare 2 midnight rule. Some of you, like myself, may laugh that that's been on there for so long, but there have been so many changes and complexities. Pain audits, which have also been on the work plan for a while, risk adjustment data, and then accuracy of place of service codes. And then, we might look at one of the audits that OIG has done as well. So telehealth services, back, this actually, well, it could have been a work plan audit item in the past, but with our current pandemic, CMS announced that they would plan to begin auditing Medicare telehealth services. As we know, telehealth expanded hugely due to COVID. So this item was revised. It was added in October of 2020 and then revised, and it's expected to occur in 2022. CMS has implemented a number of waivers and flexibilities, as we all know, that have allowed Medicare beneficiaries to access telehealth services when they hadn't in the past. We've had Part B and C data, which will also be reviewed for integrity risks associated with telehealth services during the pandemic. And then we know that the OIG will analyze provider billing patterns. And then, although there isn't a lot of detail, you should continue to watch for updates and review once the initial audit is published. So this is something I would put on both monitoring and auditing because there was so much complexity and confusion at the beginning. And then also know that it is also, we'll talk about it being reviewed for Medicaid as well. So you'd really want to take a look at your telehealth services. Know that the OIG is looking at it from different aspects as well. They'll also be reviewing Medicaid telehealth for the oversight for the state agencies and waivers. I know in Oregon, we had a lot of changes that occurred that happened during the public health emergency and are continuing. And this item was also revised from 2020 and expected in 2022. They may also put it out further, but just know it's on their radar. It's one of their items they talk about a lot. They're also going to focus on selected states' use of telehealth and behavioral health services. So if you provide behavioral health services, I would say you definitely want to take a look as one of those, see what states OIG is going to be looking at. OIG will analyze how states and managed care organizations have used telehealth to provide behavioral health care. And they'll also review states' monitoring and oversight of behavioral health services provided during telehealth. So although this audit may not impact you as a provider of behavioral health services, it may impact your state, or the managed care organizations. So you want to definitely look at what they're looking at, because there could be that trickle down to you as well. Your state or state agency that provides Medicaid, such as our Oregon Health Authority, may be doing audits as well. So there may be kind of that trickle down as, hey, the OIG is looking at this. We also need to look at our practices and how we have oversight over telehealth for Medicaid. There were 2 phases. There's additional information on the Part B, Medicare Part B telehealth services. They're going to do 2 phased audits, and this was updated during that revision. So phase 1 audits will focus on making an early assessment as to whether services such as E&M, as we know, evaluation and management, was impacted by telehealth. There were changes. Can we really do telehealth for face-to-face? How do we do physical exams? Lots of questions there. Also opioid use disorder. How did we do it with substance use disorder, end-stage renal disease, psychotherapy, to ensure that they met the Medicare requirements as set forth by CMS. So that's one. Phase 2 audits will include additional audits for Part B telehealth services related to the distant and originating site locations, which we know there were waivers on, virtual check-ins, electronic visits, remote patient monitoring, technology of telehealth, annual wellness visits to determine they met the Medicare requirements. So looking more at some of those assessment documentation, and then getting down to some of the technology that is used in part of delivering telehealth services. So what can you review for telehealth services, and either to prepare for OIG audits, or if you've identified it as something on your work plan that you're looking at? You want to look at kind of where you started when the pandemic, maybe you were providing telehealth services prior. So you may have more sophisticated processes than those who started telehealth during the pandemic. Just looking at the history of documentation, maybe looking at some of your claims early on in the pandemic and later on to ensure that you were following the requirements for billing, coding, documentation, maybe just doing a quick review if you hadn't already, maybe doing some probe audits to determine, is the documentation there? Does it reflect that the service was provided via telehealth? Or is there any documentation improvement you need to be doing with your providers? Looking at the modifiers. I know there were a lot of modifier issues that had happened. Ensuring you're using the appropriate modifiers. Some of your state Medicaid agencies had specific modifiers. So just, taking a review. I know we had a lot of flurry of information that happened in 2020, and then getting in through 2021. So just, I'd say, have a really good take on where you're at with telehealth services. Maybe they've dwindled down, maybe they're continuing on, but also look at, watching for those reports when they come out from OIG, but also looking at what your state providers have had if you're billing for Medicaid, and then also your MAC as well. So I know Noridian has had some guidance out for telehealth. So looking at what your MAC has said as well. So I'd say just have a really good take on where you're at with telehealth services, as it's a little more proactive before the audits come out. Okay, pain audits. So pain has been on the OIG work plan for a long time. It's been, the OIG has revised its focus on several areas for pain management, including facet joint injections, lumbar epidural injections, trigger point injections under Medicare Part B. If you haven't already, and I know this was a key area in some of my former employment, but you should be looking at your services and documentation to ensure compliance with the federal requirements, because this year OIG will issue a report on provider compliance. So what can you review? I know that Noridian does have several local coverage determinations on or they did, facet joint injections, possibly some of the others. So they will tell you exactly what you need to have in your documentation to ensure that you have medical necessity to bill for these claims. So I would take one of those local coverage determinations and transition it into some type of an audit tool and either delegate that to your paying departments or have your compliance office do it, and do some monitoring. Take a good sample every month and review those services and documentation to ensure that you have appropriate and adequate documentation to be billing for that. As this is one of the key areas that OIG has been focusing on. Or do a probe audit. Maybe you only do one of these services, maybe it's a new service line, or maybe you've stopped doing that. It doesn't mean it won't be reviewed as a past area for the OIG, but be looking out for this report. There are already reports out there, so look at some of the past OIG audits to see what they found with providers and what needs to be in that documentation to ensure medical necessity. So take a look at that. Depending on how you rank this risk. Maybe it's a moderate risk in your organization or something you've already looked at, so it's a lower risk, or maybe it's something you haven't. So I would think you need to make sure that you are assessing that risk and what's been done in the past to mitigate it. And then that will determine what you want to do with those pain audit reports and how you either want to monitor something, audit it, or maybe it's just an education you want to do with your providers. All right, the 2 midnight rule. Here we go again. You may know this as, several different terms over the past. So the OIG announced a revised plan to begin auditing short stay claims in 2022 related to the implementation of the 2 midnight rule from fiscal year 2014. Whew. So we're going way back. So under this rule, it is generally considered inappropriate to receive payment for stays not expected to span at least 2 midnights. This used to be the 72-hour rule, I believe. 3-day rule. We have all kinds of old terms for it, but now it's the 2 midnight rule. OIG will begin auditing short stay claims and recommending overpayment collections. So if you've looked at this in the past, you may want to look at it again. If you haven't looked at it, might be something you want to read the history on, but just know that it has revised its plan. There are audits out there from the past, but you just want to make sure you're clear on that change from fiscal year 2014 when they changed some of the specifics on it. And just make sure you also have a good understanding of where your organization is as it relates to the 2 midnight rule. Some of the other notable items are risk adjustment data, the sufficiency of documentation that would support the diagnoses. So documentation reviews to ensure diagnosis supports what the Medicare Advantage organizations had submitted to CMS for use in that CMS risk score calculation. So this is OIG auditing those organizations, which again may have a trickle down to you, but it also gives you a great way to be able to audit your documentation, your providers as it relates to the risk adjustment data. If you haven't already. And it's really a good educational piece as well. If you haven't had a lot of education in this area, it's been out for several years, but maybe it's something that you need to continually have education and training in. So looking at some of those OIG reports on the Medicare Advantage organizations will definitely be beneficial for your organization. And then the accuracy of place of service codes. Place of service codes have been audited by OIG for years and years. You'll find, audits going back to the 1990s to early 2000s. So they're going to look at the Medicare Part B physician services when beneficiaries are inpatient under Part A. So ensuring, for those organizations that treat both, acute and non-acute. So Part A, Part B, and how that works between the two. So it might be a great area to do a quick audit on. Also an area for training, especially for, coding areas. So definitely something to take a look at. So those were some of the areas I found notable on the 2020 activity, but 2022 activity by OIG. I would say that some of the items are going to be carryover from years past, but there may be new items added every month. We no longer look at, October as the year when all of our new audits come into play. But, OIG has been busy. Office of Inspector General, even the Office of Civil Rights, as we look at privacy or some of the other areas under civil rights have been extremely busy during the COVID pandemic. So they haven't stopped, as we should not stop with our compliance auditing and monitoring. I wanted to take a look next at one of the audits that came from fiscal year 2021. And this, when you go to the OIG website, you can find those audits, which could have been part of the work plan in the past. They may have taken, you can see the audit number there, 0919 03027. Maybe this was from 2019 on the work plan. But this was Medicare could have saved up to $20 million over 5 years if CMS oversight had been adequate and to prevent payments for medically unnecessary cholesterol blood tests. So if you do cholesterol blood tests, I would say take a look at this audit. This was done of Medicare paid providers for medically unnecessary lab tests. So OIG did a review of Medicare and said, wow, they had a lot of unnecessary billing going out. The review was of providers that billed for direct measurement, low density lipoproteins, LDL, cholesterol tests, and lipid panels for the same beneficiary on the same data service. So some of those providers billed the direct LDL test every time they billed the lipid panel. And these claims were at risk of non-compliance with Medicare requirements because CMS states that billing for direct LDL in addition to the lipid panel, while sometimes medically necessary, should happen with only limited frequency. So this could have been a systems issue with lab setup that, maybe one of the systems was set up to bill both. And it just happened as part of the system when it should only have been when it was medically necessary. So it taking, patient-centered, only looking at the needs of that specific patient. So you may want to take a look at that, read the audit. It talks about what they found, the $20 million that were at risk because of they were billing both of those panels at the same time when they weren't necessary. It talks about, it needs to be based on the physician's clinical judgment. So if you were to pull the documentation, would you see that? Or was this just a system set up that way with our electronic health records? So definitely something to take a look at if you haven't audited your cholesterol blood tests. It might be time to do that, especially since this audit occurred. So other items to consider with your work plan. After reviewing the OIG items, you may consider some questions related to your 2022 compliance plan, especially as we're still in the pandemic. Have you been able to get to all of the items from 2021? Honestly, I don't believe so, but has the public health emergency resulted in items being added to your plan that might be somewhat outside the typical scope of your compliance work plan? Or maybe you have some items related to COVID test billing or vaccination codes. So definitely, I would say for a lot of people, yes. Due to the public health emergency, will you be narrowing the focus of your plan or expanding your plan? So do you have the same resources you had, in 2019, 2020? Maybe not. Maybe your compliance folks are working on something else related to COVID. So how can you continue working on your plan? Perhaps it's narrowing it, but continuing to work through it. But also adding in some of those other items related to, the public health emergency. Were there items you deferred during 2020 and 2021 that you may need to be pulling in for 2022? I would say probably yes, that is true. I know in my experience it was true. So is there something that's, we had very different insight in 2019, 2020 than what we do now, very different focus. But as you see from the OIG work plan, the work has continued from HHS and OIG as they work twofold on the public health emergency response, but also working to ensure the financial integrity of our Medicare and Medicaid plans and beyond. I just say that for us, but all of the other areas under HHS. So those are things to consider with your work plan for 2022. Just to wrap up, some of the key takeaways are utilizing the OIG work plan as one resource. In the past, maybe it's been leaned on more than it is now, but it is one resource that help you create your audit work plan. It's not the only resource, especially if you have different types of service lines or payers. There may be other trends and priorities you need to add in. Use the OIG activities as educational items for board and leadership. If you want to do an education on cholesterol blood tests, that's a key area to show kind of how an audit's done, how you could look at documentation improvement, how you can look at systems issues as well, or what the OIG does and why it's important that we pay attention to what the OIG is doing, either through its work plan or audits occurring, even if it's on CMS or Medicaid, and it may not be on providers directly. There is an indirect or sometimes direct relationship there. Also, many of the items can be used as FYIs for future activity or upcoming changes to CMS rules. So you'll see there are some items that OIG has planned for future that may change as CMS rules change, or they even as OCR rules change. There are some privacy and security issue items as well. So having an FYI, and that can help you plan. Maybe it's you have a list for 2023 you're going to look at. So definitely keep it in mind for future audits. Well, I hope that's been helpful. I want to thank you for your time today. If you have any questions, you can reach out to MRA staff and they can get a hold of me. And I look forward to working with you in the future. And I hope that this was beneficial to your compliance program and compliance efforts. Thank you.